Hey everyone, how are you doing on this beautiful, beautiful Wednesday? Really nice weather here in the city. Of course, we are Real Talk for Real People looking for real solutions. I'm Tanya Rivens, and this is Canceling COVID. Thank you for joining us. I missed you on Friday, but certainly we honored Good Friday, a great reason to just take a break and everyone kind of refresh and renew. And that's kind of the season that we're in right now. So, on Canceling COVID, I thank you for joining us. I appreciate all of you that reached out and your faithful, loyal viewers, listeners that want to continue the conversation as we work together to build stronger families and communities. We're in the middle of a global pandemic, guys, and you've been right there with us the whole time. So, the big question in every home and church is where do we go from here? And that, of course, is what we are striving to do. And what is happening now, Amelia, if you could go to, I would say, kind of switch over to, you guys have to bear with me because here's what's happening. I was not prepared like I should have been today. So, what you're going to have to do is give me a chance to regroup because I have the wrong transcript up. So, if you would bear with me and give me a chance to get the right transcript, I don't know if Mill has something that she can put in, but I am Tanya Rivens and I'm known to make these kind of mistakes. What can I say? I'm human, right? Okay, which is no excuse. But clearly, as I started reading what I was working on, I realized I had the wrong transcript for the show. So, what I'm doing now is regrouping, taking a deep breath, working on a couple of things. So, bear with me, folks, as I get the proper transcript because I even didn't even bring my backup, which is something that I normally do. But guess what? I've got it together now. So, we're going to start this thing over and it's Canceling COVID. I'm Tanya Rivens. Thanks so much for joining us. We are working together, as I stated before, to bring together real solutions in our communities. And we're in the middle of a pandemic. Now, a major update for you: half of adults in America are expected to have received at least one dose of the COVID-19 vaccine by the end of the weekend. And this comes as President Biden pushes up the deadline for states to make all adults vaccine eligible. That's anyone 16 and up can already get a COVID-19 vaccine in both North and South Carolina. And the original date was going to be in May concerning nationally, but our president has moved it up. But here, you're eligible today. On the national level, it's going to be April 19th. So that leads to our question of the day on Canceling COVID. We keep it real and we want you to as well. And our question is: have you noticed communities of color have become more accepting of the COVID-19 vaccine? I would say that I have, but what about you? You think people are more accepting now? And it would be interesting to hear from people on why they think people are more accepting. So we see the numbers are improving in our community. More and more are starting to get the vaccine. What is your take on that? Of course, I see some of you hopping on already. I appreciate that. And what can I say? I've got it together now. So, becoming more accepting of the vaccine, a new national poll seems to suggest so as well. Now, take a listen to this. The percentage of U.S. Black adults who say they have either received a vaccine shot of COVID-19 or want one as soon as possible, it is now at 55%. That's how much it increased in March. That's up from 41% in February. And that's quite a jump. So, obviously, this education piece is starting to help. It's starting to work, and that's good for a lot of us, especially our scientists and our medical experts, and it's good for everyone. According to the Kaiser Family Foundation, these numbers are quite impressive. I am really impressed to see that this has happened. So I see my sister Travis has hopped on. Good morning. She's got a question. Anna Louise Pryor Gates. Good afternoon. Good afternoon to both of you guys. And so we got a question already from Travis saying, is your child taking the vaccine now that it's available? So we're going to talk about that. Please weigh in. Are you going to allow your children to get the vaccine? 16 and older are eligible now. So let's see where that goes. I understand a lot of people are excited, not just in our community, but we got the numbers we just shared with you. 41 to 55% is quite a big adjustment. And of course, there's a group of six phenomenal women. I'm so excited. Maybe that's why I'm all over the place here. There's some professionals, doctors right here in North Carolina. They're helping to lead the charge to cancel COVID. WakeMed Sister Circle, that is a group of skilled and compassionate doctors who have vaccinated more than 8,000 people. That is an accomplishment right there. And a group of sisters that have been featured nationally for the work that they put in. I'm honored to welcome my very first guest, Dr. Rashida Monroe. She's from Sister Circle. Dr. Monroe, thank you so much for taking the time to join us. I really have been looking forward to talking with you.
Thank you so much for having me, Tanya. It's such an important conversation. I'm thrilled to be a part of it.
Well, thank you so much. Now, the work you all are doing with improving vaccine equity is gaining national recognition. A lot of people are talking about the work that you all put in, and it just speaks to the heart, not just of women, but I think it speaks to the heart of Black women in this country as well. How we tend to just take ownership and say, you know what, I'm going to handle this. We're going to do what we need to do. So I really appreciate that. So you're a medical doctor. What has it been like to see the devastating effects of COVID and especially what it's had on our community?
Yeah, it's been heartbreaking. I'm a pediatrician and I work in Southeast Raleigh. My clinic is based here. And many of the people that I work with come from, vulnerable backgrounds. And I've seen so many of our families who have lost multiple family members or have lost, jobs due to COVID. People are really struggling. I mean, children coming in with mental health issues, anxiety and depression and isolation, and
Mhm.
it's really been heartbreaking.
Yeah.
Even for people who have fared well from a medical standpoint, there's effects on all of us. And so it's been an absolute blessing to be a part of this vaccinating effort because it finally feels like after a year, there's something I can actively do to
Yeah.
get us out of this mess. And so that's been a joy for us.
You know, Dr. Monroe, as I heard you sharing that, it's interesting. As a journalist, there's a story that's running now here in Charlotte about, how it has affected our medical professionals, 1 year. And I think a lot of times people forget you
Mhm.
all are human as well. You're a professional and every bit of the way as far as administering and doing what you do. But you also have a family, you have lives that you live outside of that profession. So let's talk about Sister Circle. I mean, how did that come about?
It's so interesting because we are a group of women who had met pretty organically, to work together. One of us, knew someone else, and we kind of became a group without a name necessarily, just as a support for each other as, Black women navigating this space as medical professionals.
Mhm.
Um, and so it's actually been, a couple of years ago that we started kind of coming together and communing and sharing stories and advice and support for each other. And so this is well before the pandemic. By the time the pandemic started, and then there was the George Floyd murder and
Yeah.
racial unrest and COVID and all these things, we we started speaking to each other about what can we do, like how do we help support our communities, how do we turn this kind of this moment into a movement, like
Mhm.
what can we do to join forces. And so this past fall we started thinking about a media campaign, showing us getting our vaccines, talking about vaccine hesitancy, putting together programs to inform and educate. And that's how we started from a COVID-19 vaccine standpoint, was this past fall.
Wow, it's great to see how now you've evolved to being even more involved, which is of course the Sister Circle. So kind of tell us what you do that's getting you all this great recognition.
Well, so in January, I volunteered to vaccinate at a drive-through vaccine event that our health system hosted. And it was wonderful and so well run. But what I noticed was that we weren't represented there. People of
Mhm.
color were not the people getting vaccinated. And I just thought, how can we change this? And that's where the Sister Circle came in. And we came up with a plan, and we reached out to our community members through church organizations and other faith groups, Divine Nine, other community groups, and said, your communities, who's in need, who's been suffering during this pandemic, who's been disproportionately impacted, from a illness, death, and economic standpoint, let's reach out to our community. And so we did that and reached out to our community members in Southeast Raleigh, really trying to hit one of the hot spots in North Carolina that's been very impacted by COVID.
Mm-hmm.
We had an absolutely overwhelming response that very first week back in January, and people were thrilled and desperate to get vaccinated. And
Mm.
we realized that our biggest problem wasn't going to be hesitancy, it was going to be access.
Yeah.
So we made it our mission to help overcome the barriers to access.
So I can see, obviously, the community has responded. The people that are receiving the vaccines. I think right now you guys have vaccinated thousands. I believe I saw a figure of around 7,000 or so, which is quite impressive since you all have gotten started. But what kind of response have you been receiving from people who haven't gotten the vaccine, or any type of feedback, like families that you've, or actually people that you've actually helped? Like, I'm sure most of them are grateful.
Absolutely. So at this point, we've delivered 12,500 doses of hope. And
Mm.
this weekend, we'll be doing second doses, 1,500 second doses. And absolutely, the most common response is just overwhelming gratitude. I mean, at the very beginning with our seniors, I mean, people were so anxious and confused about how they were to register, and didn't have computer access or
Right.
that, or and the thought of being on hold, and I mean, it was just overwhelming. And so when their pastor or church member called them and said, do you want to come get your COVID vaccine this Saturday? All you need to do is show up. Like, there's no computer pre-registration, just come and we handle the rest. People were overjoyed. And so that absolutely is the response that we're getting. It's interesting though, in the beginning, there was a ton of demand, but the supply was so low.
Right.
We're getting more and more supply. We're starting to get to that those hesitant people who initially said, I don't want to go first, but they're coming up and they're saying, you know what, I did this because I saw X person get right. Whatever community member, or if my grandma can do this, then so can I. And so I love that you mentioned that number, from 41% to 55%. I think that's what we're seeing, that people are going, this is a safe vaccine. And we just keep seeing more and more evidence about the safety and effectiveness of this vaccine. And now that it's my turn, I'm ready to get it. So that's what I'm hearing.
Yeah, well, that's good. But there's still some people out there that are a little bit hesitant, and they mistrust healthcare when it comes to people of color. What would you say to those people?
So, I have these conversations all the time in general as a pediatrician,
Uh-huh.
having hesitancy about vaccines. So these are conversations I have every day. And what I try to do is, one, validate people's concerns, right? You can't just dispel and say, that's unreasonable without hearing. I mean, there is a legacy of mistreatment in our Black and Brown communities. It's not just Tuskegee. I mean, that's the one people think about and remember, but it's not just that. And so I like to validate and say, hey, I get it. I understand that. But this disease has disproportionately impacted my community and yours. And I think it's our responsibility to help save and protect our community. I think of when I get vaccinated, all the my family members and community members that I'm then helping to protect. And so I just try to kind of flip it on its head and say, let's understand our history and understand the hesitancy, but let's talk about evidence. Let's talk about protecting our community. I like to think about this vaccine. I think it is for us and by us. I think of Dr. Corbett,
Mhm.
American physician who helped develop this mRNA vaccine. I think of the legacy of Henrietta Lacks, who contributed to the science that helped develop this vaccine, and I think of our community who's been disproportionately impacted by COVID. And so I believe it's for us and it's by us, and I just encourage everyone to get it.
So, Dr. Monroe, I'm going to ask you the question of the day, but if I could get our producer to put the picture back up, I want to acknowledge everyone that's in the sister circle, and because I was just thrilled when you guys were responded and willing to join us. So, can you identify? I don't know if you can see the picture or not, but I want to acknowledge these amazing sisters for coming up with this plan and getting out and helping us a lot of times. And I heard this when we started in the COVID, and that's what I've been trying to operate on. There's help out there, but we've got to get back to us helping us. And that's what you guys have done.
So I can't see the picture, but I'll let you know the other 5 women who are in the sister circle who have been out there, helping to register and vaccinate patients since January. Dr. Michelle Benoit Wilson is an obstetrician. Dr. Natasha McLawhorn is an obstetrician. Dr. Jacqueline Hicks is a family physician. Dr. Narissa Price is a psychiatrist. And Dr. Tiffany Lopane practices obesity medicine, all here at WakeMed.
And you are some talented sisters that are taking care of your business. That's what we like out here, professional and representing. So I certainly appreciate that. Now, I do have the question of the day. If you can answer that for me, is we've already kind of talked about it. You notice communities of color are most impacted. They're now becoming more accepting of the COVID-19 vaccine, but you say you still have those that are kind of taken away. I'm going to flip it a little bit and say, when you look at percentage wise, you're seeing more that are speaking up for it or less when it comes to comparing the ones that are anti-vaxxers. And I don't mean just because I had a conversation yesterday and someone said, I'm not an anti-vaxxer, I'm just against this vaccine. So
Mhm.
would you say it's about a 50-50 split, or it's definitely more people now in favor of it?
The data would suggest that there are more people now in favor of it. Certainly, my perspective is a bit skewed because I'm encountering many more people who are desperate and saying, please help me find one, right? If I
Huh?
get in this vaccine event that you guys are doing this Saturday, help me find a vaccine. So my view is skewed and I see overwhelming demand
Okay.
and interest. But sometimes people will come get vaccinated, come to the vaccine event and say, but you know what, I'm still hesitant. And they just want to talk to someone.
Mm,
People who are hesitant, they don't mean they never would and wouldn't consider it. They just want their questions answered and their fears, allayed, right? So,
right.
we had a woman come, 2 Saturdays ago who was just like, I just wanted to speak to a physician, and I pulled Dr. McLawhorn, who's an obstetrician, and this woman wanted to know just about, fertility and pregnancy and those types of things, and she had her questions answered and she got vaccinated. So
Oh,
when I hear hesitancy, I think this is an opportunity. Let's have a conversation. I mean, this
r-
is you. Let's talk about it. Um, so I do hope that we'll get there. And if we're trying to get to, 75, 80%, vaccinated to achieve herd immunity, we have to think about what that looks like in our community, right? That's not
right.
for the entire state or the entire country. If you're concentrated in, a black or brown neighborhood, that means your neighborhood.
Yeah.
So we have to all be ambassadors, and get vaccinated and encourage and help other people get vaccinated too.
Oh, that's a great response. And thanks for sharing that story. So I'm going to start to wrap things up, but I want to say you kind of alluded to that. You opened up the door to what I was just going to ask, because people are asking about other health issues. They just want to know, do you think that this will lead to us being even more proactive about some of the health issues that we have in our community?
I hope so. I mean, this entire year has just really shown a spotlight on how the structural inequities in our community not just impact us, ongoing in ways that we know about, but when there's an acute crisis, how we are disproportionately impacted. There's nothing about the biology of being Black that puts us at increased risk for COVID, right?
Mhm.
But the socioeconomic factors that make us more likely to live in low resourced neighborhoods without access to healthcare and insurance, increased risk of high blood pressure and diabetes and all these different things that are structural factors. Uh,
Yeah.
so I think people have really, really taken note of that. And I hope that this isn't just a moment. I hope it's a movement.
Right.
people really start to focus on, how do we bring equitable resources and promote health equity in our neighborhoods.
So, Dr. Monroe, real quick, what's next for Sister Circle?
That's an excellent question. We are having conversations amongst ourselves and with our partners in the community. We have partners throughout the health systems in the Triangle, and we just think it's really important that it's not even siloed to our health systems, right? That we're thinking about this like more as a community at large. Like, how are we working together to promote health equity in Black and Brown communities? And so I think the sky's and we hope to continue to get in some good trouble.
Yeah, well, I think you guys will, and I am thrilled, certainly humbled that you have taken the time to talk with us. Again, Sister Circle of WakeMed, some powerful African American women who have come together and have taken ownership, helping us, us helping us, and just not limited to us, but addressing the issue of those that need it most, which is one of the things that we need to do so much more of. So, before I let you go, is there anything else you would like to share?
I just want to say thank you so much to all of the volunteers. We've worked with over 300 volunteers who every weekend sign up to help deliver these. And so this is nowhere close to us, just the Sister Circle. This is like 300 people who donate their Saturdays to help with this. And also, I thank WakeMed for supporting this and giving us the administrative and structural support and access to vaccines that we need to make this happen. So I'm very thankful for those two things.
Absolutely. Dr. Monroe, thank you so much, and all the best to Sister Circle as you all continue to work in the community. Such a beautiful lady and great to talk with her. And she's right. When we reached out to Wake Med, they were right on it. So I see you guys hopping on. Some of you are not as chatty today. Again, Travis Rivens asked, is your child taking the vaccine now that it's available? If you'd like to weigh in on that, 16 and older. Our question of the day, we need for you to chime in on that. Have you noticed communities of color are becoming more accepting of the vaccine? Again, Anna Louise Pryor Gates, if you would like to hop in on that, Erica Simonton Beatty. Also, that's our question of the day. Of course, the CDC is giving North Carolina $94.7 million. That's a whole lot of cash to expand COVID-19 vaccine programs and ensure greater equity and vaccine for minorities and other groups overwhelmingly affected by COVID-19. I hope some of that is going to be used towards education, I might add. Now, we've got our second guest who joins us every Wednesday. She's a sponsor of the show, and we love the nuggets and the wisdom that she shares as you continue to chime in on the question of the day. We're talking about Dr. Tracia Black. She's boots to the ground for free COVID-19 testing and now vaccinations, which I'm excited to hear about that because we've been talking
Yes.
get tested, then get the vaccine. So, Dr. Black, let's get started first with the question of the day. Have you, of course, you're out there with your pulse on the community. Have you noticed communities of color most impacted? They're now becoming a lot more accepting of the vaccine.
Yeah, I think so. I noticed that there's a lot more positive dialogue in our community about the vaccine. I think folks are more open to exploring whether or not they're going to take it. I think, like Dr. Monroe said, they're open for conversation. They have questions as opposed just to adamantly refusing, I'm not going to take it. I don't necessarily see the rush to get the vaccine that Dr. Monroe is experiencing in Wake County. And we're still traveling all over North Carolina. So when we set up our testing sites, we're specifically targeting communities of color. We're going to communities, we're in the neighborhoods, but I find that there are more non Black or brown individuals that show up to actually get the vaccine. So we're interested, we're talking, but we're not necessarily moving forward with rushing to get it.
And that's definitely progress compared to when we first started this. Even the conversation and the dialogue is good as well. So Erica Simonton Beatty says her daughter is taking the vaccine. She came home from college this past weekend to take her first dose. So, to the point that we are becoming more accommodating. Now, you recently added vaccinations to the free COVID-19 testing services that Groundwater Solutions provide. How's that going, and how many people have you been able to vaccinate on a daily basis?
It depends on the location. Sometimes when we're in the small towns, we may have 60 or so, 60 to 75 folks show up. When we're in the larger cities, we tend to see about 200 to 300 people. I think one day we vaccinated 275. That was our largest number on a one-day event.
So Jacqueline Hill says her brother is in the wait and see mode, and I would say that's not a bad place to be in because
Mhm.
again, we know that in our community, people are not going to jump on right away. Some people are not. Now, for you and what you're offering, is an appointment needed? Is it required?
No, it is not. They can just show up, just very similar to Dr. Monroe. Shh, I'm sorry, you all. My children are coming down the stairs.
That's okay.
Diamond, I'm on the TV. Shh. Okay. Okay. I'm
Uh,
sorry. No,
that's
they
all
can
right.
just show up. They can pre-register if they like, but
Okay.
if not, we are on site. There is no appointment necessary, and it's all drive-through mobile vaccinations.
Now, are you all doing the two part or do you have the one shot?
We have the two-shot Moderna.
Okay, so you got the two shot Moderna. So where
Mhm.
can we
We,
find you
we
all
are
out today?
requesting Well, we are requesting the Johnson and Johnson vaccine, which is the one dose vaccine, specifically for
Mhm.
our community. We believe that that's going to be a better fit, the one shot and done option. So we are making some special requests to obtain that vaccination.
So where are you out today? Where can people get scheduled or get on the schedule? I know like your calendar
Okay.
so that they can start getting these vaccines or
Okay. So
vaccination.
today we're at Kittyland Daycare in Salisbury, North Carolina today. We're also at University Adult Daycare in Charlotte, North Carolina today. Friday, we will be at Faith CME Church in the Hidden Valley neighborhood. Friday from 11 to 3. And again, anyone can show up. We'll be out of Charlotte on the weekend in Oxford, North Carolina, and in Goldsboro, North Carolina.
Yeah, you're gonna be at Face CME with Pastor Gripper. I love her. She is
Yes, I
such
love
a
Pastor
servant.
Cooper.
Yeah, I was talking
Yeah.
about her, I think, earlier on another show. She's always
Mhm.
there and always willing to serve this community. She's a Sunrise
Anything for
mom
the
too.
community. Yes. And
Absolutely.
for the first time we were there with her was a couple of Fridays ago. And so we'll be there every 2 weeks at Dr. Gripper's church. And she literally was driving, going to pick people up to bring them to get the vaccine. So she is fully invested in the health of our community. I love her. Yeah.
Yeah.
But if
That's
anyone, you can go to our website, www.groundwater-solutions.org, or you can call our office at 704-596-0505 to find out where we are. And again, you can just show up.
so groundwater-solutions.org. And what's the number one more time?
704-596-0505.
Dr. Black, you've been amazing on helping us out. The sisters have run the show today, and
Yeah.
I'm so glad to be lined up with you guys. As we wrap up with you, is there anything else you would like to share?
Now, again, I like to leave every week with just be healthy. Everybody keep doing the things that we we are supposed to do to stay healthy. Get tested, get vaccinated, and find somewhere that you trust. And I think when people see folks that look like myself or Dr. Monroe, there is a trust factor there. So we're available. Call us and we'll be here. Okay.
And that's great to know because you've given us, again, valuable information. And in a lot of ways, you've led the conversations
Mhm.
that have prompted people to have conversations that have
Mhm.
not been held. So, Dr. Black, thank you for partnering with the show and thank you for joining us. I look forward to talking with you again on next week. And again, today, I know you said you're at Kittyland. And so that's one of the locations in Salisbury. And just one more time, any other location, you can go to our website, groundwatersolutions.org. Now, a couple of you guys I see you on. We've got a few minutes. If you'd love to chime in the question of the day as we get ready to have off the air quickly, is do you see an increase or a lot of people around you kind of now they're on the fence, they were on the fence, but they weren't having it. Now they are more than likely to get the vaccination and they're trying to get in line, especially now that we have opened up in North Carolina. We didn't do anything. Governor Cooper did. He opened it up to 60 years and older now can go ahead and get the vaccination. And of course, the president is opening up for the entire country on April 19th. Of course, way, I really sincerely appreciate Sister Circle of WakeMed. You can look them up. They're featured on CBS News. A great story, a great provide professionals. Because I think sometimes we forget, they have another side away from the doctor's office, just like you and I. And they're human. They have families and they have other things. And obviously, this group of ladies, they've got empathy and passion for what they do. And again, Dr. Rachel Black, always here on Wednesday, talking us out. They get the word out. We've been very fortunate. Now, on Friday at 1 o'clock, make sure you hop on. We got Congresswoman Alma Adams. Again, Congresswoman Alma Adams will join us on Friday. And still know that the sound is acting up. Well, we're at 1:30. Thanks, sis, for making me aware that it's time for me to go anyway. As always, so let's chat. I was just you better not better. Together, we're going to cancel COVID. We're going to keep working at it every Wednesday and Friday at 1 p.m. Thank you for hopping on. Even after we hopped off, you can still respond to our question of the day so that we can share it. And make sure you share the show as well. Keep sharing as we continue to spread the word and educate our community. I'm Tanya Rygans. Thanks for tuning in, everyone.